Okay, my name is Lennart Hardell from Sweden. I'm an oncologist, been working many years in oncology, and my research career started actually back in late 1970s, early 1980s, when I made cancer studies on the Agent Orange stuff. We had the same type of chemicals in Sweden used in forestry, and it turned out to be related to an increased risk for specific types of cancer, soft tissue sarcoma and non-Hodgkin lymphoma. And these studies became part of the Agent Orange trial in the United States, and also the basis for compensation to Vietnam veterans for specific cancer diseases. Afterwards, it has of course been shown that PCBs, which is the major contaminant in Agent Orange, is a multi-site carcinogen to humans, so it gives different types of cancer and also other diseases, and has been classified as a group 1 complete human carcinogen by IARC, which was decided some 20 years after our initial studies. But there was a growing international body of evidence that TCDD is cancer-causing, as well as Agent Orange, of course, too. We have also made many studies on pesticides related to cancer, mostly on the lymphomas, and one of the pesticides was, besides of these Agent Orange herbicides, is glyphosate or Roundup. And we found an increased risk for non-Hodgkin lymphoma associated with use of Roundup, which has been confirmed in, or rather, I would say, shown in 2 other studies, one from the United States and one from Canada, and these were one of the bases for classifying glyphosate recently by IARC as a group 2B possible human carcinogen, which is of major impact because this has to do with the gene modification and of course the Monsanto production of these products, and also should have an impact on the use of these compounds like glyphosate, because they are freely to be used nowadays. You can buy them in the shop and use as much as you want. Well, since more than 10 years I've been involved in research on brain cancer and the relationship with mobile phones and cordless desktop phones, and we have found a clear association with an increased risk with such use, which has been confirmed by other studies and were the basis for, again, classifying by IARC as a possible human carcinogen group 2B in May 2011, and we have continued with such research. Well, I have not really done research much on electrohypersensitivity by myself, but I have followed the literature, and it's clearly that the evidence is there that this is a real disease which is related to exposure to electromagnetic fields, and these people need to be recognized as diseased and not like a psychiatric disorder, which many doctors by now tend to say, oh, this is psychology, this is psychiatric disease, you need to have cognitive treatment. Instead, they need to be carefully taken care of in the hospitals, and what we now during this conference address is the need for diagnostic criteria, and also that they should have a international code of diseases like other diseases, an ICD code, and because that would facilitate for physicians to treat these patients and take them seriously, because as long as you don't have a diagnosis, it's easy to dismiss them, because okay, you don't have an established diagnosis. And one of the problem is, of course, that the symptoms can be specific for different individuals, and that there is by now no established criteria for establishing the diagnosis. We need to establish the symptoms and also to have biological markers. And from that we need to go on to have WHO to accept this as a disease and also to establish treatments. But, yeah, I've seen some of the results and they are very interesting, really. So, yeah, yes, these markers may contribute to a diagnosis in the future because he has looked in different separate markers but also a combination of markers and finds that several of the markers are increased in electrohypersensitive persons.
You mentioned that the biochemicals I'm not heard
Sorry to...
If you could name Dr.
Yeah, these studies are made by Professor Belpom in Paris, and he has been studying some 1,000 patients with mostly with electrosensitivity, but also with multiple chemical sensitivity or a combination of these tools. And he finds markers that can be useful in the future for this patient category. But we need also have education of the persons in the society so that they can get more knowledge, because most people think that there is no problem with the electromagnetic fields. We need also education of medical doctors in the future.